Well, it may not go down. I mean, quite honestly, I mean, that's one of the reasons why it's so important. If everyone followed the guidelines, if everyone wore a mask in public, if everyone were cautious, it would absolutely go down, without a doubt. But people are eager to be normal, and we have a new normal. We have to embrace the new normal and find a way to live with this thing, because we're going to have cases, you know, going forward as far as the eye can see until we get to the fall, when there's a really high likelihood that it's just going to skyrocket and we'll be having other challenges. So we just got to be prepared and make sure that we reinforce that message that people don't need to let their guard down. Not that we don't need to live, we just got to find a new way to live with this new reality.
Let me just also add that the continuation of new cases is not something that is a surprise to those of us who have been in this fight from a public health perspective for the last however many months it has been. The goal of our policies has never been to completely eliminate the spread of the virus. I don't know how many times I have said that sitting here. Our goal has been as follows. If you are a Mississippian who can get better with quality care, that you have access and availability of receiving that care. Our goal has been to protect the integrity of our healthcare system. That's the reason very early on you saw us bring Dr. Brunson and Dr. Hayes in, so that if we did see the spike, which thank God we never saw the kind of spike that they saw in Louisiana. We never saw the kind of spike that they saw in New York and in New Jersey and in some of the northeastern states. What we're seeing now in, or saw in Detroit and now more in Illinois. We never saw that huge spike in cases. We were prepared for it if we did, but when you look at our hospitalization and you look at our number of patients with COVID-19 in ICUs, when you look at the number of COVID-19 positive patients on ventilators, it's been relatively flat for almost 40 days. And what we have to realize is that the virus is in every community. We have to be diligent. Dr. Dobbs' point, which is we need 100% participation in the smart policies that we are recommending or requiring in certain areas. We still have a shelter in place for those individuals that are over the age of 65, as well we should. This virus is particularly cruel to those in that category, those who have pre-existing conditions. You look at the number of fatalities. Sadly, but true, of the 500 plus fatalities, 80 of those are individuals over the age of 90. An additional 129 are individuals over the age of 80. An additional 155 are those over the age of 70. An additional 120 are those over the age of 60. It is those individuals that are particularly compromised from an immune system standpoint and those who are older that are most at risk. Everybody is at risk, but those are the ones that are most at risk. The reason that everyone is at risk is because some of us in society have pre-existing conditions that we don't even know that we have. It's just a fact. And so that's the reason everyone needs to be diligent. When you're out in public, you need to wear a mask. You need to be smart. We all want to get back to normal everyday life. But the normal today is different than the normal was 3 months ago. We can do things, but we have to understand that there are risks. Viruses such as the flu, they are spread from person to person, and this particular virus is clearly far more dangerous than many viruses that we've dealt with in the past.